Welcome to another episode of the Bandage podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance. In this week's episode, we cover new housing at hospitals, the genetic company Ancestry, healthcare travel for employees, and health risks for poor hearing. Let's wrap things up. This is episode 3 for the week of October 21st. I'm Matt Moneypenny.
And I'm Alex Ross.
Before we get started, our diagnosis code of the week is W60, contact with non-venomous plant thorns, spines, and sharp leaves. Alex, I think this has a lot to do with our current season, fall.
Well, no, because all the plants are dying back. But let me tell you, this happened a lot over the summer because I got this new kind of exotic form of squash.
Oh, boy.
You've probably never seen a squash with thorns, and neither had I, and that's why I just kind of reached on in there to pick that squash that looks so beautiful, and landed myself in the emergency room with W60 contact with the thorns and spines of this sharp plant.
Yes. I think really
cause.
This code is popular during fall, Valentine's Day with those roses, and mowing the lawn. So throughout all of summer, I think there's a huge risk for landscapers particularly, and maybe even Beast from Beauty and the Beast. Remember that rose that kept him alive? I think he was diagnosed with W60.
It's interesting that it says non-venomous plant, because venom is something you have to be bitten with rather than
poison ivy.
Yeah, that's not venomous though. That's irritating.
Yeah.
Well, I guess it could be poisonous. If you ingested it, it would give you some internally bad afflictions. But I wonder if this could be as benign as I brushed my aloe that's on my desk, and well, now I have a diagnosis.
Yeah, maybe. Now I'm hit with a medical bill. All right, let's get right into the news here. New housing available at hospitals. Denver Health is partnering with Denver Housing Authority to repurpose an old building on the hospital's campus into affordable senior living. Legally and morally, hospitals can't discharge patients who have no safe place to go. This housing space will serve as a transitional unit for those with nowhere to go after they no longer need medical care. The housing group will have a case manager to help with physical and behavioral health needs to prepare residents for life on their own. It costs Denver Health $2,700 per night to keep someone in the hospital. This housing unit will cost the hospital $10,000 per patient per year, a much more affordable option for the hospital. This type of housing is on the radar for many other hospitals.
That's pretty great that they have some, leftover space that they can transition in that way. I saw an article the other day about a old mall being transformed into a high school, and using the common areas as common areas and the stores as classrooms. It was kind of a really cool transition, and that's kind of what this makes me think of. We got an old hospital wing that's not really being used, so why not make it kind of like a hotel?
Yeah,
you got all these rooms.
I think that makes a lot of sense. I think part of the reason why medical bills are so expensive is because of boarding. I mean, $2,700 per night. That's like a 5-star hotel. That's like a 5-star hotel every single night. Mm-hmm. I mean, that's insane. And I think maybe, it's a better option for college students because boarding at a college campus is super expensive too. So, I mean, let's see if they can get into that.
Well, if it's only going to cost them $10,000 a year, that's cheaper than rent in a lot of places. Yeah. Maybe people will end up at the hospital for a while.
Yeah.
Yeah, and then you have access to the delicious and wonderful cafeteria.
Oh, nothing better.
Right down the hall.
Absolutely.
Now, I'm serious about that. There's the local hospital. We used to go there every Wednesday morning back in high school.
Wing Wednesdays.
Yeah, no, for breakfast. They would serve this hash brown casserole that was absolutely phenomenal.
It seems
Not found anything like it anywhere else. So, hospital cafeterias, A+.
That seems a little ethically weird, don't you think? Going to a hospital for lunch or breakfast?
No, they don't mind. You're paying for it. So.
True, it's true.
And really, how do they know that I'm not there visiting someone?
Right,
really?
True.
Next up, Ancestry steps up rivalry with 23andMe. Ancestry, a consumer genetics company that helps people understand their family history, now offers new products to get health information based on DNA results. This new strategy is different than 23andMe's consumers order 23andMe's products, but a physician from Pawn Health will order Ancestry Health's products. Pawn Health is a New York-based nationwide network of doctors with the mission to enable safe and easy access to diagnostic testing.
Alex, I think this is kind of interesting, especially when Ancestry and 23andMe are getting into DNA and health, anything related to that. There could be some serious PHI concerns, especially, it's just another massive company that has access to not only potentially your PHI, but everyone in your family's PHI as well.
Mm-hmm. Is your genetic DNA test a PHI? I don't know.
No,
I'm asking honestly. Like, if someone were to come across a report of my DNA, is that protected health information? I guess it could give you some information on my predisposition to any number of genetic diseases, and therefore could be used to market to me in some way or potentially scam me.
Yeah.
Is it protected in the same way?
I don't know. It just kind of depends on how in-depth this health information based on these DNA results gets. Mm-hmm. Because at some point, hackers actually will use the information of dead patients because they can't complain. If they're doing fraudulent things, people who are dead, unfortunately, can't look at their credit scores or figure out that there's any issues going on with their actual identity. And if they do it right, they can get away with purchasing illegal drugs, scheduling appointments, and things like that. So that's kind of an interesting thing.
Interesting. I know that companies like 23andMe and Ancestry do maintain kind of a library of people's DNA and have on occasion shared those in very specific circumstances. So I do wonder if they're governed by a different set of rules than your standard HIPAA in regards to that, though it is health information.
Yeah, especially since they're partnering with a health company. So there might be some BAAs involved there.
That's a business associates agreement.
Yeah, thank you.
You're welcome.
More travel for Amazon employers, but for health treatment. Amazon will pay travel costs for workers diagnosed with cancer to see doctors at City of Hope, the Los Angeles area health system. Employers are choosing to pay workers travel because they can get competitive prices and the employees can get better care, such as avoiding an unnecessary treatment by shopping around for health care. Amazon's goal is to increase workers' choices of medical care and decrease employer health spending. Obviously, this is a win-win situation for Amazon. Obviously, Amazon's going to spend less on healthcare while giving their employees more choices for their healthcare needs.
Yeah. And it's kind of interesting with these situations that it may be more cost-effective to send someone to a better hospital than it is to have them treated locally.
Yeah, that is an interesting fact. And I think Amazon's just really kind of stepping up healthcare across the board, whether it be offering healthcare services to employees internally or externally as they're just increasing Alexa's healthcare skills like we mentioned last week. Every single episode that we've had so far on the Bandage, we've mentioned Amazon in some capacity when it comes to healthcare. So
it's interesting that they're always in the news for healthcare. Do you think we're going to be seeing the local Amazon hospital popping up soon?
Maybe. One day, free hospital visit coming soon to an Amazon retailer near you.
If you have Prime, you can get through the emergency room a little faster.
Yeah, right. There's more to Prime, including appointments.
Yeah. You can book it online up to 2 days in advance. Next up, health risks from poor hearing fall silent.
What?
Next up, health risks from poor hearing fall silent. A pair of hearing aids, on average, costs $4,500 and needs replaced every 5 to 7 years, but currently are not covered by traditional Medicare. Only 15 to 20% of those who need hearing aids actually have them. Studies show that people with poor hearing have higher healthcare costs and are at a higher risk for dementia, falls, depression, and social isolation. Currently, there is no connection between hearing loss and other health problems, just an association, but there is speculation that the increase in cognitive load on the brain from muffled sounds may be a risk factor for dementia. Frank Lin, director of Cochlear Center for Hearing and Public Health at Johns Hopkins University, is running a study to determine if giving hearing aids to those who need them reduces other health complications.
I never really thought of that, them having those associations with dementia, falls, depression, social isolation, because it's kind of hard to look beyond the fact that they can't hear, and it's such an unfortunate thing that they have to deal with the rest of their life. So it's great that they're doing this study to see if there's any kind of associations and if there's anything that they could do to help reduce them.
Yeah, this tells me that I should probably start saving for my inevitable hearing aids in the future and have a nice little backup savings account to be able to pay for those.
Yeah, right.
I definitely listened to my music a little bit too loud throughout high school. So
yeah, you were one of those cool kids playing the live music in your car.
The cool kids where you could hear my music just as well as I could as I'm walking down the hallway.
All right, with that, let's move on to our next segment.
BREACH, Breach Patrol. It's a breach!
All of the latest cybersecurity breaches. Welcome to Breach Patrol, where we go over the latest cybersecurity breaches across the world. First up, we have South African bank systems had security vulnerabilities that exposed the personal data of those who applied for home loans. E4 Strategic, the company that develops and maintains the systems, confirmed the flaws, but insisted that they had been patched and there was no evidence of leaked data.
So there's no evidence of leaked data, but we know that there was a security flaw. So how do we know that? Do we know that because of leaked data? Or what's going
this
on
whole
here?
this whole thing seems a little bit sketchy. It might be one of those things where it's one of those scam phone calls where it says, "Hey, I'm an African prince. I just need your social security number," and then they actually go through with it and they get that information because it's a home loan. I mean, that's a potential.
There's an issue with security on these home loans, but the good news is they were all American social security numbers that were being exposed.
Right, exactly.
No, I'm joking. In all seriousness, E4 Strategic is going to have some cleanup to do here. It sounds like they were serving a number of different companies because they're in charge of the system that the banks use to then handle these kind of home loan applications and that process. Yeah. So that's probably going to lose them some contracts.
Yeah, I wonder what the law is for this type of breach in South Africa.
Good question.
And it might depend on what type of data they're dealing with and what their customers are coming from, like what country they're from. So
Next up, school district learns the hard way. Confidential employee information was accidentally shared in an email at Lucia Mar Unified School District. An email was sent to several district email accounts that included a file with employees' names and social security numbers. It still isn't clear how many employees' information was sent, but the district assistant superintendent said that the district is doing everything to fix the situation and safeguard the information.
Yeah, I think this breach is a little vague as well. They say that an email was sent to several email accounts, but they don't say who sent the emails or where they came from or why they were sent. Maybe it's because it's ongoing. Or where they were
sent to.
Yeah, right. That's all information that's really important, right? I mean, you need to figure out if this was something that was an accident or if it was actually premeditated, and then why they were sending it and where they were sending it.
I can see two distinct situations that could have caused this. The first one is, well, oops, I clicked the wrong file and attached it and didn't even realize it. My bad. Still some cleanup to do. The other one is maybe willful ignorance with perhaps some kind of phishing attack.
Yeah, exactly.
Where someone said, oh, hey, real quick, I just need the social security numbers of these couple employees. Could you send them over? Thanks. Interestingly enough, when I was in college, somehow we fell victim to a phishing attack. And while I'm sure that employee is no longer there, what happened was essentially someone said, hey, real quick, if you could just send me over the W-2s for all of the employees of the entire college. I kid you not. Every single person who worked for that college was breached in this.
Wow.
And they just kind of zipped it up and they're like, here you go. Here's the W-2s. And then they're like, oh, crap. That's not someone I thought it was.
Oh my gosh.
So unfortunately, this happens with people not thinking about what they're potentially doing. And that kind of tells you why it's so necessary that every email that comes into my inbox has that huge yellow blinking banner that says, warning, this email comes from a different server. Do not click any links unless you trust the sender.
Right. And in order to actually avoid those phishing attacks, and I mean, you just need to be vigilant and you need to train your employees, right? I mean, that's really what it all comes down to. If they're ever presented in a situation where they're just mindlessly going through emails, that could be a really bad thing. They need to make sure that they open every email with the intent of knowing who they're getting it from, and just in case, making sure that they're not sending anything that could cause a breach, especially across a college campus.
Or even double check the email of the person it's coming from.
Yeah.
That's probably one of the biggest ways that these things happen, is that they spoof some name. I get these emails all the time. Like, the name that the email's coming from will say something like, it's Bank of America. But the email is like random characters at rocketmail.com. And it's like, okay, that's probably not Bank of America. Treat that with caution.
Yeah, right, exactly. Is there a college prep program for data breaching? A Maryland school district student improperly downloaded information and test scores from more than 1,000 students from a college preparation program, Naviance. District spokesman said that the student wrote a program or algorithm that tried various combinations of usernames and passwords to gain access. The student will face school discipline and possible criminal charges. What's interesting is obviously this student had some pretty malicious intent. I'm curious as to why he was doing this. Maybe he was just testing his hacker abilities. But something to take away from this is when people do these types of attacks, and I mean they get criminal charges, they get disciplined, but after all that and the dust settles, if they get away with something like this, companies want to hire them to hack their systems.
You can't see my face right now, but I'm just straight awestruck that a high school student was able to write a program that brute forced its way into 1,000 different accounts.
Right.
In this program, which I assume should have some level of security. So either it has no security and the passwords were all 1, 2, 3, 4, or this kid is straight up brilliant, as criminal as he may be.
Yeah, right, exactly. And that's kind of what I'm saying. It's like, after everything and all the dust settles, maybe these companies will contact him and just pay him 6 figures.
I chose the wrong career path.
Yeah, this guy's a genius, right? And another takeaway that's interesting here is this was Maryland, written by the Baltimore Sun is the original source. And Baltimore is still recovering from their ransomware breach. So maybe if this company, this college prep program, Naviance, was from Baltimore, I mean, there could be a correlation here that things in Baltimore are just not secure.
All right, let's get serious about this for a minute. Think about it this way. What we have here is a high school student who was able to brute force his way into 1,000 accounts. Okay? Yeah. What does that mean for you? That means that the same password you've been using since 1984, that is only 6 characters long and contains only a letter and a number, is probably not safe. It's time to go change it.
Yep, definitely. Dude's a genius, for sure. I mean...
Wow. I hate to call him my hero, because you probably should not be doing this, but wow.
Yeah, it's definitely not something you should be doing. But
absolutely incredible. And that's it for this week's wrap-up of your weekly healthcare news. I'm Alex Ross.
And I'm Matt Moneypenny.
And we'll see you next week. Thank you for joining us for this week's episode of The Bandage. This week's episode was written and produced by Etactics. Etactics is a leading revenue cycle solutions organization committed to providing innovative, web-based solutions that improve our clients' cash management and customer relationships. Thanks, and we'll see you next week.